Medicine has evolved tremendously over time. Breakthroughs in the treatment of diseases and physical ailments have instilled hope and relief in families and loved ones during perilous times. Unfortunately, the cost to reveal these standout moments of medical majesty is one that too many are unaware of. The suffering, pain, and torture of targeted populations of African Americans is yet another example of crypto racism that the world vehemently chooses to ignore. In order to heal, the public must acknowledge the unwilling sacrifices made on people who were treated like lab animals simply due to the color of their skin. In 2006, author Harriet Washington published a book entitled The Medical Apartheid, the very first comprehensive history of physician-led experimentation on Black Americans. While each and every experience detailed in this book holds an immeasurable significance to the malpractice and maltreatment received by each victim, three cases stood out. Probably the most notorious event, the Tuskegee syphilis experiment, was preceded by the barbaric methodology of Dr. J. Marion Sims, who is more affectionately called the father of gynecology, and more recently, the young African American children between 6 and 10 years old who were injected with fenfluramine, a major component of the now disreputable obesity medication fen-phen, simply because they were the younger brothers of incarcerated youth. Syphilis is a sexually transmitted disease that is initiated when the spirochete bacteria Treponema pallidum, or flexible, spirally twisted bacterium, enters the human body through mucous membranes or any variety of orifices, including the genitals, rectum, or mouth. After entering the host body, the Treponema pallidum bacteria makes its way into the bloodstream and thus begins the 4-stage infection of syphilis in an untreated host. The initial stage, also known as the primary stage of syphilis, occurs 3 to 4 weeks after the initial exposure. This phase of the sexually transmitted disease often results in the development of a sore called a canker located on the area of the body where the Treponema pallidum first entered. The secondary stage of syphilis usually occurs between 4 and 8 weeks after the initial exposure and can result in a skin rash as well as other symptoms such as fatigue and general body aching. The third stage, or latent stage, of the disease takes place shortly after the first anniversary of the exposure, and the disease begins to infect major organs, including the spinal cord, heart, and brain. In the last stage of syphilis, the tertiary stage, which can occur at any point after the first year since initial exposure, results in extensive damage to the organs and often results in death. The treatment for syphilis may seem like a pretty simple solution, as the medication administered is penicillin, a very common antibiotic, but unfortunately, this solution was not provided to the men in the Tuskegee syphilis experiment. In 1932, the Public Health Service partnered with the Tuskegee Institute on an experimental project who claimed that their research was to record the natural progression of the syphilis disease in order to justify treatment programs for Black Americans. Flyers were posted in heavily populated African American communities with multiple benefits for participants listed, including free medical exams, free meals, and ironically, burial insurance. This study was initially begun with 600 African American males, 399 of whom were infected with syphilis and 201 unaffected. The researchers did not bother to obtain informed consent for any of the men, which means that the exact details of the program were not disclosed to the participants. Most of the men in the study were not even told that they were being observed for the progression of syphilis or whether or not they were actually infected with the sexually transmitted disease. Rather, the men in the Tuskegee experiment were told that they were being treated for having bad blood. The term bad blood referred not only to syphilis, but could also mean anemia or fatigue. The Tuskegee study was initially supposed to last for 6 months, but ended up being in effect for 40 years from 1932 to 1972, Even though in 1947 penicillin became the standard treatment for syphilis, the researchers in the Tuskegee experiment never administered the medication to any of the affected men in the study. Additionally, the Tuskegee men were never offered an option to exit the study even after the penicillin treatment proved to be effective in eradicating the disease. The administrators of the Tuskegee experiment executed one of the grossest violations of human rights by withholding treatment of the syphilis disease to the infected men and simply stood by to witness the men die so that their cadavers could be examined for the ravages of the disease. Childbirth has always been a dangerous apex in a woman's life. A mother is never closer to the brink of death than when she is trying to bring life into the world. Back in the early 19th century, women would often undergo labor that would last for days, and the modern drugs available to expectant mothers today to alleviate some of the excruciating pain were not yet invented. Even if they had been, enslaved women would not have been the recipients of this pain relieving elixir. Many times, during the labor, the infant's head would be too large to pass through the mother's pelvic canal, and the infant's head would trap the soft, malleable tissues of the pelvis against the pelvic bone, which would result in the restriction of the blood supply, and without this flow, tissues would often die, and the walls of the pelvis would begin to deteriorate, resulting in the formation of obstetric fistulas. There are two types of obstetric fistulas, the first being a vesico-vaginal fistula and the latter being a rectal vaginal fistula. In vesico-vaginal fistulas, the wall between the bladder and the vagina breaks down and creates a hole, causing the woman to become incontinent with urine escaping through her vaginal canal uncontrollably. In a rectal vaginal fistula, the wall between the rectum and the vagina breaks down, causing fecal matter to escape through the vaginal canal. Either form of fistula can result in the production of infection, unpleasant odor, and over time, the inflammation and scarring of the surrounding body tissue, specifically in the upper thighs. In the early 19th century, there were no cure for these fleshy lesions, that is, until Dr. James Marion Sims began his sadistic and barbaric surgical experimentation on multiple enslaved women who were regarded as no more than chattel in his efforts to claim notoriety and infamy. In Dr. James Marion Sims' autobiography entitled The Story of My Life, Dr. Sims describes how he would have acquired two of his enslaved women test subjects, Anarcha and Betsy, via a proposition to slave owners, stating, "If you will give me Anarcha and Betsy for experiment, I agree to perform no experiment or operation on either of them that will endanger their lives, and I will not charge a cent for keeping them. But you must pay their taxes and clothe them, as I will keep them at my own expense." Dr. James Marion Sims kept both of the enslaved women for over 5 years, performing as many as 30 surgeries on any one given enslaved woman, all of which were performed without the presence of anesthesia, as he was quoted as saying that black women do not feel pain. The surgeries themselves were terribly painful. Not only had Sims to close the unnatural openings in the ravaged vaginal tissues, but he had to make the edges of these openings knit together. He opted to abrade or scarify the edges of the vaginal tears every time he attempted to repair an opening. He then closed them with sutures and saw them become infected and reopen, painfully, every time. Several male doctors had initially assisted Sims by holding down the enslaved woman as he made his incisions, but within a year they could bear neither the bone-chilling shrieks of the woman nor the lack of progress any longer. These doctors left, leaving the women to take turns restraining one another. Professional word of mouth had detailed the inhalation of ether as an anesthesia since the early 1840s, and Sim knew of this, but he flatly refused to administer anesthesia to the enslaved women, as he claimed that his procedures were not painful enough to justify the trouble and risk attending the administration. But this claim rings hollow when one learns that Sims always administered anesthesia when he performed the perfected surgery to repair the vaginas of white women in Montgomery, Alabama, a few years later. Informed consent allows patients and their parents or guardians, in the case of minors, to preview the outlined sets of objectives for the research in which they are agreeing to participate in. This includes any potential risks or benefits of the study. In New York City, a study was being conducted between 3 research institutions, which include the New York State Psychiatric Institute, sponsored by Columbia University, Queens College, and Mount Sinai School of Medicine, to determine if aggressive and hostile behavioral issues were genetically passed down through siblings. In this study, 100 local New York City African American boys between the ages of 6 and 10 years old were administered intravenous doses of fenfluramine, a known neurotoxic medication which caused significant brain cell death at therapeutic doses, in order to test a theory that violent or criminal behavior may be predicted through the levels of certain brain chemicals. Fenfluramine had been known to cause heart valve damage and an overstimulation of apoptosis of serotonergic brain cells. None of the adolescent test subjects had a history of aggression or criminal behavior, but rather were the younger sibling of an incarcerated older sibling. The parents were not given informed consent of the research program objectives, and the families targeted were in the lower end of the socioeconomic food chain. In exchange for allowing their children to participate in the study, the families were compensated with $125. $125 was the amount of value that the researchers placed on the lives of these minority children. At no time were the parents informed that fenfluramine would be administered, and the known dangerous side effects were never disclosed. The National Institute of Mental Health, more commonly known as the NIMH, funded this program, which exemplified psychiatric and medical racism at its worst. These doctors were willing to use minority children to conduct medical experiments that could not have been conducted on more affluent white children. This study was of absolutely no potential benefit to the children. In fact, an NIMH study published in 1989 stated that fenfluramine produces serious side effects yet has no therapeutic benefit. These children were given a dangerous drug with no possible benefit to them. This is an unethical practice as outlined under the standard guidelines for medical experimentation on children. Injustice and inequality derived from the bias of color is a narrative which transcends the test of time. Systematic oppression of persons of color is not only a recurring theme within the history of medical advancement, but sadly is a practice seen throughout American culture today. The paintbrush of racism illustrates vivid imagery throughout medical experimentation in history. Perception is the vehicle which allows many to take comfort in the fallacy that racism is no longer a prevalent custom. Sadly, this viewpoint is one often taken by those who have never been affected by discrimination's vicious blade. Complacency, in lieu of competency, is a moral bypass to the issues which still exist. As a society that holds fast to the claim of progress, we hold a moral obligation to humanity to correct the injustices of the past, and not to rest on the fictional ideology that time will heal all wounds. That which is uncomfortable cannot be allowed to further be ignored. Now is the time for change and healing, and this begins with acknowledgement of the past.